Okay, this is going to be a slow, methodical application of the FlowSafe disposable CPAP device. It's really never really a good idea to run in and strap something onto somebody's face. Remember, they're going to be hypoxic, they're going to be scared. You've known them all for about 2 or 3 minutes. They've never seen it before. One of the best descriptions sometimes that people use is to describe using CPAP is like sticking your head out the window of a car while it's going down the road, that blowing into the face. And most people have seen that or have done that themselves and can understand the analogy of that or the comparison. So what I normally like to do is I like to ask the patient, can you go ahead and hold the mask for me? I like the patient to stay in control. They have some say of what's happening, makes them feel like they're involved. So I let them kind of hold on to the mask. Now I'm going to start out on a rate of the heart failure patient. The flow is going to be at 15 liters per minute or 5 centimeters of water pressure. That may be the right place, it may not, because we're going to have to titrate based on how the patient performs. You notice I don't have my hand over the end. Again, that could cause an increase in pressure. Some patients will say they'll start to pull it away. They get a little bit of anxiety, a little bit of claustrophobia. That's okay. Let them stay in charge of it. Let them do it. In the meantime, you're starting to exert some pressure where you're going to take control of it, but let them stay in control. If they get too upset, I've actually had patients throw up into their mask, because we're going to try to avoid that. As they're doing that, you can have yourself or you could have your partner, and a lot of times it can be a second rescuer, will come in and attach the straps. The strapping system that we have here, we have the little pins on the mask, and they just slide right over the top, and you've got one on the top and one on the bottom for each one. And if you remember, compliance has to do also with comfort and getting this mask on. Now I have half the straps. Now you're going to have a second rescuer, and some of you may even ride with a third and fourth rescuer. Make this part easier. You got to slide this around. It's going to go onto the crown of their head, and we're going to bring this around, and as you can see, it comes around to the other side. My patient's going to be very cooperative here, and he's going to help me a little bit. And we're going to come on, and I can have him move his hand. Move this finger, please. And I'm going to get that strap on, trying not to pull his hair. And then I'm going to get that strap on, okay? Now these CPAP devices come with a variety of masks. You can have a smaller one, a medium one, and a large one, and it's okay to stop and change masks. Excuse me, if you find that this is not fitting correctly. You can ask him, how comfortable is that? How does that feel to you? He may shake his head, okay? The other part of this, you may have to be popping these masks off to give nitro. You may be incorporating capnography into these. This is all fine. Some of these masks can even be used to put breathing treatments through. For a patient you may want to give a bronchodilator therapy would be okay. Again, now you're assessing the patient. I kind of like to keep my hand on their shoulder. I like to talk to them. Breathe with it. This is going to help you breathe. This is going to make it easier for you. Try to stay away from negative comments. They're already in probably the worst state that they're having in a while. So we're going to try to stay positive all the way through this. If he's still having some trouble with it, turn your flow up. Give him the air a little bit faster. Make it to where see if we can meet that. But if he's fine with the 5, and we're getting some compliance with it, and the mask is comfortable with him, then we're doing fine. See how is the saturation, is it getting better? Is his work of breathing to you, does it appear to be better? He's not working as hard. It's not as difficult as it was. Again, I would continue to talk with him. Whoever gets that rapport with the patient should stay with that patient all the way to the hospital. They start having a good working relationship on how things are working. If the flow is not working, bump it up, go up to 20 liters, get 7.5. Now, these numbers may change if you end up in your protocols that you're doing this with chronic lung patients, your asthmatic patients. You may start and titrate from lower numbers, such as 2.5. Again, follow your protocol and what you're allowed to do. At this point, I'm going to monitor him all the way. He's probably going to have an IV started. The thing that you got to remember is that most of you will be using D cylinders or E cylinders. The D cylinder, which is common in the system that I'm using, if you're running this at 15 liters, you're going to get about 1 minute for every 100 that is in your tank. So as part of the preparation, we actually carry a second tank with a regulator on and try to start every call with a minimum of 2,000 in your tank. That way I know I have 20 minutes. I work in an urban EMS system, short transport time's not a problem for us. But if you work in a community that's longer transport times, having a second, third bottle, second regulator to change out would be very valuable. Okay, once you arrive at the emergency department, you're going to find that you're able to leave the disposable CPAP device that you spent a significant amount of time getting fit and making the patient comfortable can stay on the patient. We did a survey of the emergency departments in our county and found that most hospitals only had about 3 or 4 CPAP devices, many of which were in service. So a lot of them for sleep apnea or for whatever patients that needed it. What were they going to use in the emergency room? Now we can leave our device behind. Another area that is being noticed is during our recent pandemic flu, the H1N1, it was predicted our community was going to need 35,000 ventilators. We know we only have about 1,000. Well, there are a lot of those folks may have been able to be sustained using the CPAP device, and the disposable would be the ideal, especially in an infectious disease environment. So there's no way we're going to be able to meet the demand of ventilators, but through a disposable device such as the FlowSafe, we'd be much better chance of meet that demand. As most of you know, the CPAP device that we have comes out with a mask that's more of a disposable, smaller version, but the new mask that's coming out, as you see, will have some innovative features that the other mask doesn't have. It's going to have a more comfortable, flexible strapping system, and it also has the supports on the forehead to take the pressure off of the nose. One of the more areas that most people complain is where the comfort issues are. As a lot of people realize that in respiratory, the adapters, everything is pretty much the 22 milliliters or 15 millimeter adapters, so the valve is going to plug directly into the mask, as you can see. The flow rates are still the same. We're still going to do 15, 20, and 25 to get our 5, 12, 7.5, and 10 centimeters of PEEP, but you'll notice we'll have a much more comfortable mask. As we can demonstrate here, the straps are already on, they're Velcroed, is we could actually have the patient hold it, as we do in most of our CPAP administrations, let them hold it, only this mask can be brought over to the top of their head and much easier to put on, and then can be adjusted just like any type of Velcro to get the better fit. One of the advantages that this mask has over other masks is one of the things that we want to do to patients that are on CPAP is to be able to give them nitro. And every time I take the CPAP mask off, I lose the pressure and the value of the therapy. In this case, I'm able to take the mask, I can raise it up very quickly because of the strap stretches, give them the nitro, and put the strap back down. This is an advantage over most other masks that we're seeing out on the market.